Hi, my name is Elizabeth, and today I'm going to be demonstrating a focused assessment on the cardiovascular and peripheral vascular systems. As always, I will start by introducing myself to the patient, performing my hand hygiene, and asking permission. Hi, my name is Elizabeth, and I'm the nurse today that's going to be performing your cardiovascular assessment. Are you okay with that?
Yes.
Okay, and can you please tell me your name and date of birth?
Bob Ross, 1980, May 19.
Thank you. I will explain everything as we go, and I'm going to get started. Okay, we will start the assessment by inspecting, as always. So the first thing I'm going to look for is the jugular venous pulse, and just glance at the carotid artery as well. So in order to do this, I'm going to just have the patient, I'm going to be on their right side and just have them turn their head to the left. And then the first thing I'm going to look for is identifying the external jugular vein, which you can see right here. You can't see the internal because it's too deep behind this, but you should be able to see the pulsation along here. So with him, I can see it right about here. Sometimes you need like a little bit of a light to see it, but his is pretty strong right here. And he is leaning back pretty far, so if you were to sit up, it might move a little bit. So sometimes if you can't find it or if it's really low, leaning them back could help. So what I'm going to look for is that highest point of pulsation, and then I'm actually going to take a measurement from here. So what I'm going to do is, from right about here, I'm just going to take a card or something like flat and stiff, and just hold it out from there. And then I'm going to take my ruler and just do a measurement of this gap right here. And his is about a little less than 1 centimeter. And anything under 3 centimeters is normal. So his venous pulse here looks good, and that measurement is normal. So then moving on to inspection of the heart. Okay, so for inspection of the heart area now, what I'm looking for is any like visual pulsations, any lifts or heaves. So the chest really rising here. Sometimes you can see the point of maximum impulse, which would be right around here. I actually don't see it on him. Usually people with more muscle mass, you can't see it. If they're thinner, sometimes you can. So everything here, I don't see any of those pulsations, those lifts, or those heaves. So next we will move on to palpation. Okay, I will start palpation by palpating the carotid artery on both sides. So yep, if you just put your neck neutral there and relax. So I'm just feeling for the artery here. We want to avoid going too high and feeling up there. And we don't want to ever do both at the same time because that can cut off blood flow to the brain. And I'm feeling for the amplitude, and I'm also feeling for the upstroke. You should feel a brisk upstroke in this, and it's that's what happens after S1 and before S2. And I'm just also noting the strength, and he has a nice strong pulse. It's not weak and it's not thready. Moving on to palpation of the heart. So when palpating the heart, I'm going to start on the right side here, on the right sternal border at the second intercostal space. This is the aortic space. And then I'm going to move over the same in the second intercostal space over to the left side. And this is the pulmonic area. And then I'm going to move my fingers down to the third and to the fourth, feeling Erb's point. And when I'm doing this, I'm feeling for thrills, any heaves, any lifts. There, it's like my fingers are kind of being pushed off of him. And then I'm going to move over to the midclavicular line in the fifth intercostal space. So after I move down, I'll move over to the midclavicular line. And feeling that apex of the heart, feeling that apical pulse. I'm feeling it for size, so it should be about 3 centimeters in diameter. I'm feeling for strength again. Is it strong? Is it weak? He has a nice strong pulse here. And then also the duration. And then if you're having trouble feeling this, what you can do is have the patient roll over to the left side. So I'm going to have you just kind of roll over to your left side. That's your left, yes. And sometimes it's just a little bit stronger if you do it over here. Okay. And then you should always palpate in this position as well, all those spots that we talked about for the same things, just because some changes can occur. Okay, you can go back to your back. And that is it for the palpation. We will now move on to the auscultation. The first thing we will auscultate for the assessment is the carotid arteries. And we're listening for bruits with this. And I'm going to use the bell and the diaphragm side. So I'm just going to, sorry, this is a little bit cold. Place this here and take a listen. And always doing both sides. And flip that around. Do this side. Okay. And a bruit could be present in someone with cerebrovascular disease. Or sometimes if you felt a thrill while you were palpating, which is kind of like a cat-like purring or vibration, you could also hear the bruit with this. So it's kind of important to compare those assessment findings. And then sometimes you can mistake a murmur for a bruit because the murmur from the heart can radiate up. So it's important to, if you do hear something up there, to also listen here and compare findings to see if you hear a murmur here. So now we'll move on to auscultation of the heart. Okay, with auscultating the heart, we're going to do this very similar to the palpation. And again, I'm going to listen with both sides of my stethoscope. So I'll start here with the diaphragm, and then we're just going to start on the right side here in the second intercostal space. And what I'm listening to here is just for normal S1 and S2, any abnormal sounds, and then again just moving down to the third, to the fourth at the Erb's point, and the fifth, just kind of inching my stethoscope down, and then over to that midclavicular fifth intercostal space to hear the apex. I'm listening for any murmurs, I'm listening for any extra sounds. If the S2 is split, this could be a normal result of the pulmonomic and aortic valve closing separately. And this can happen if there's too much pressure in the lungs. So if you listen while the patient is exhaling, that could get rid of that. So if you do hear something, just have them exhale and see if it goes away. And then we're going to do the same thing with the other side. We're also just noting the rate and the rhythm thing, and just kind of work our way down here to all the spaces, and then over to, we're just making sure that we hear the sounds in all those locations, and again just assessing the strength. And then we are also going to auscultate. You can do the same thing with the patient in the left lateral, you should. I'm not going to demonstrate that just because it's kind of hard to turn here and see it. But then we also are going to auscultate with the patient sitting up. The reason we auscultate with the patient sitting up as well is because there might be a soft aortic insufficiency or murmurs that can only be present while the patient is up and leaning forward. So go ahead and just lean forward a little bit for me. Good job. We're just going to do the same thing, listening at all the points. Inching down. Going to the apex here. And the same with the other side. And we're listening for all the same things we were earlier. Excellent. And that concludes the auscultation. Okay, to begin the peripheral vascular portion of the assessment, we will start by inspection. And I'm just going to start up top with the arms. And so I am just looking at the arms, noting the size, the color of the arms, are the hands white, like they're not getting good blood flow. I'm also looking for any edema, so any swelling or pitting. And then I'm looking for just the normal venous patterning of his veins. To see just if they're kind of flowing in the right direction. Okay, next I'm going to look at the fingers for clubbing. So I'm looking at the fingernails, and what happens with clubbing is the nails become enlarged and they're very curved. That could be a sign of heart disease. And then we will move on to the legs. So with his legs, we are just looking for the same things. I'm looking for the color, making sure his feet or his lower extremities, again, aren't white or pale. I'm looking for any edema. I don't see any swelling. If I did, I would determine if it was pitting or non-pitting. So pitting means when you push in, it leaves an indent. And non-pitting is swollen without that, and then graded on a +1 to +4 scale by how deep the impression is with the edema. And then I am looking also for hair distribution on the legs. If you notice the bottom of the legs or the feet are very shiny and don't have any hair, that could be a sign of insufficient blood flow. And then just also kind of looking at the normal venous patterning of his legs as well. And then I will also take note if his legs have any ulcers and decipher how long they've been there and if they're healing or not. A lot of times, on the back of the feet or the back of the legs, with peripheral vascular problems, you'll find ulcers. I'm also looking for varicose veins or varicositis. And so those would be swollen veins that are kind of popping out. It can be really noticeable and kind of like crooked in nature. A lot of times you'll kind of see them on the back of the calves here or back of the legs. No varicose veins. And then also noticing if I see any blood clots. The back of the calf is a very common area for those. So that would be swollen, red, and very tender if we saw any of those. The next thing we will assess is palpation. And so I'm going to start with cap refill. So I'm going to determine in all 4 extremities. I'm just going to push on his nail bed, and then how many seconds it takes for it to return to pink after it kind of goes white is your cap refill. His is about 1 second. I'll check with this finger. And the same, of course, comparing, and then I'll do it down in the toes as well on both sides. Okay. And then I will palpate pulses. So we will start with the radial pulse, and I am assessing for strength, rate, and rhythm on those as well. If you can't feel the pulses in any spots, you can get a Doppler machine and Doppler over to find where the artery is. Okay. And then so this is the radial, feeling on both sides. And then moving on to the brachioradialis, kind of in the bend of the arm here. Sometimes it takes a little movement to find it, kind of feeling around a little bit. And you just use your 2 fingertips and just kind of lightly push in. Okay, and on this side, just relax that arm down, thank you. And then on the lower extremities, I will feel the pulses in the dorsalis medial, right in the foot here. Again with 2 fingers, lightly touching, noticing is it strong, is it weak, thready. And then I'll feel the posterior tibial, so this is a good position to have the patient in. Actually, I'm gonna bring that out just a little so I can get 2 fingers under the knee here. And I kind of start with my fingers together and then kind of inch them out until I can feel the pulse. Okay, and on the other side, same thing, kind of, yeah, straighten that leg just a little bit for me. And I believe I misspoke. This is the popliteal pulse. I may have said that wrong. And then we'll also feel the posterior tibialis in the feet as well. And then you can feel the pulses here too. Okay, the next thing I'm going to do is perform the Allen test. And this is something, you can relax your fist for a second. This is something that you can do before drawing from an art line to make sure that you have artery sufficiency. And what I'm going to have you do is open and close your hand several times, like quickly, yeah. Okay. And then I'm going to have you squeeze a closed fist. And what I'm going to do is compress his radial and his ulnar arteries here with my thumb. And then I'm going to have you open your hand. And then I'm just going to release one of them and watch the hand pink back up. Okay, and then do the same thing. Yep, and then make a tight fist. And I'm gonna compress them both again, and then release my thumb from the other one. Or open your hand first, and I'll release my thumb. And we can watch the hand pink back up so that we know both arteries are working well and supplying. So it just determines the patency of those arteries. So while I was kind of doing all of his pulses and everything, I was also palpating his skin temperature. I'm just making sure it's warm, dry, not moist. Okay, next I'm going to palpate and auscultate the femoral pulses. For the purpose of this video, we will stay clothed, but normally the better assessment would be to not have any pants on. So I'm just going to feel here his pulses and kind of feel the aortic pulse here and kind of branch out and feel them. Okay, and then I'll auscultate as well, using both sides of the stethoscope again. You could straighten your legs just a little for me, thank you. And the other side. We'll listen for any bruise here. Excellent. The last part of the examination is to do an ankle brachial index. And this looks for peripheral insufficiency. You can see if you have peripheral artery disease. It compares basically your blood pressure from your ankle to your arm. Unfortunately, I do not have a blood pressure cuff today, so I can't do a real one on the patient, but I will just kind of describe how you do it. You'll take a blood pressure on both arms as well as both ankles, and you'll take the highest ankle pressure point and divide it by the highest brachial pressure point. So if it was 128 over 60 and 139 over 60, you would just divide the 128 and 139 to get your index. And anything between 0.9 and 1.4 is normal. And if it's outside of those lines, usually it would be lower to indicate peripheral artery disease. And with that, that concludes the cardiovascular and peripheral vascular assessment, including inspection, palpation, and auscultation. Thanks for watching.